Public opinion polls played a huge and controversial role in the 2010 congressional battle over health care reform legislation. Now, a team of University of Pennsylvania researchers headed by Dr. David Grande has analyzed 84 of these 2009 and 10 polls to determine just how accurate they really were. The results of that study has been published in Health Affairs magazine and provides new insights into the political craft of poll spinning, as well as shortcomings in many of the country's mainstream newsrooms.
Well, certainly during the health reform debate, there was just a flurry of polls, and those polls in many ways became the news story about health reform. And so new polls were coming out, every few days during the peak of the health reform debate. And in each instance, whatever the results of that poll were driving the news coverage about what the public, quote unquote, thinks about health reform. And it really became somewhat of a circus. Each week, a different poll would show a wildly different result from a poll from just the week prior. And the news coverage of that would suggest that somehow the public had changed their views. The fact that the differences were so large in different polls on the same exact policy was pretty surprising. So the public was very sensitive to how these policies were described. And the magnitude of that, I think, was much greater than what I would have expected. And so we focused on the individual mandate and the public option as two very concrete, highly publicized policy proposals to say, what did the public think? But when we looked at how the questions were asked by each polling organization, there were differences in the way the policy was described. And we could actually explain more than half of the variation in results in those polls based on just the inclusion or exclusion of a few key words or phrases that were used to describe the policy. So let me give an example. When the public option was described as being similar to Medicare, that was associated with about a 10 percentage point increase in support for the idea of the public option. The problem with the press was they were reporting on each and every poll in isolation and would extrapolate from that the public's views were rapidly changing. And so we very well could have had some differences in the legislation that resulted from health reform. I think that the public option was dispensed of, largely because members of Congress were worried that the public wasn't in support of it. I think a close look at the polling doesn't really show that that concern was true. So I think that, again, members of Congress, very sensitive to polls, very sensitive to public opinion, so it's pretty important for the media to get the reporting of those polls correct.